the first time I'm picking up my camera since the last good moments. I'm currently at the hospital with my guardian angel, Sarah. In short, I don't even have a guardian. It's not a guardian angel I have a guardian army, because our family is involved. But yeah, I started feeling a lot of pain this morning, which became worse, and I just had to call the ambulance, and we're here, we outside. And what else did I want to say? Yeah, they've taken my blood samples. It came back with good. However, I have to go into radiology to check my appendix because they were not able to find it or see it, because the placenta is definitely pushing everything downwards. And yeah, level of pain right now, 5. A few minutes ago, 7. And it just keeps on coming. It just keeps on coming and going. But yeah, Sarah has been my backbone.
A little bit uncomfortable. Well, that's the only thing I can offer.
Is it
the only thing I can offer. I'm so sorry.
At this point, this will last you to tomorrow morning.
For me, that would be big enough for, like, I don't know, the entirety of it.
Yeah.
Okay. Right. How to get to radiology?
My personal chauffeur.
I don't have a license, but I can drive a wheelchair.
Okay. Jesus Christ. Like, the pain is given when you hold P for too long. I don't...
The first thing, see Röntgen.
I'm tired. It feels like when you hold P for too...
Oh, sorry.
When you hold P...
a license. Forgive me.
When you hold P for too long... Ah, God, they should have left me on that bed. I'm dying right now.
They were almost there. We have to turn here.
Oh, okay. You have to do it here?
Okay.
Say hi. Why are you shaking your head?
Right here.
I've been vlogging since yesterday.
You've been vlogging? Eh?
No, I only took one video now.
What?
I only took one video, I just remembered. Yeah.
Vlogging pains.
Wow. Because I'm going to remember.
Vlogging.
But yeah, this is day 2 at the hospital.
The 2 they last. This is the last day. Tomorrow we're out again.
Baby is doing very much well. Like, baby is not even disturbed. Especially the way they showed it yesterday. It just looks like, I don't even know what's going on here. Baby is very much not even disturbed.
Yes. But this is not where you did the examination.
No. We were before. And yeah, they're saying that I might have ovaries as well as yeah. I just basically wanted to come here and explain, kind of, because due to the pain and everything that was going through, I didn't really vlog and explain everything that was going on. So basically how I ended up where I ended up and how I ended up having a laparoscopy surgery was that I was basically at my best friend's house and I started feeling this pain. Sorry for any noise that you may hear. The window is open because I'm always feeling hot. I started feeling some pains like here. Yeah, around about here, somewhere. and I really hope you guys can hear me. And yeah, I started feeling some pains, and on that day I was supposed to go back home because I spent the weekend over at her place, and the pain just started, and I couldn't even eat because she actually made me breakfast. So I was eating, and then the pain started, and then I was like, you know what, I can't eat anymore. Let me just go to bed so that by the time I wake up, I can shower and then leave to catch my train to go back home. Lo and behold, I woke up, went to shower, and in the shower, the pain escalated from like 5 to 10 or to 100 real quick, to the extent that I literally came out of the shower with soap and everything all over my body. I was just screaming Sarah's name, and I was just like, help, 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 help. And then she comes, she helps me, takes me to the room, and we try to like figure what exactly is going on, but we're not able. So the first thing that I thought of doing was just to call my sister. Shout out to my sister, Udwak, because she's a nurse. So I was like, throughout the pregnancy, if there's any little thing, I'll call her. Not only because she's a nurse, but she's also a mom, right? So I will always just call her and be like, look at this, hear this. Is this, is something happening or something like that? So, so basically, yeah, that's what happened. And then my sister was asking me if I was having like something like contraction, because in her head, maybe it was something related to baby or stuff like that. So we wanted to make sure that we take the right measures. So she told me to take, I think, paracetamol, but at that moment we didn't have paracetamol. We only had ibuprofen, and I'm not allowed to take ibuprofen right when you're pregnant. So I was like, okay. But then the pain was so much that all of this conversation I was saying, it was literally Sarah that was talking to my sister, because I was just screaming in pain and all of that. So lo and behold, we just had to call the ambulance, and thank God the ambulance showed up like very much as soon as they heard I was pregnant, right? So they showed up real quick, and they just started asking me questions if I had appendicitis and all of that. And because of where I was feeling the pain, they basically thought that it could be appendicitis, right? Yeah, so then they were like, you know what, but they don't want to like make any judgments yet, and really they don't want to make any judgment yet, so they want to like take me to the hospital, and then they're like, they would know if it's that or not. So getting to the hospital, that's when you see me like laying down. At that moment when I was filming the first video, the pain has subsided, not because I'd gotten anything, but just because the pain used to like go, and when it's coming back, that's when it's like, coming back like full force and all of that. So that was when the pain has subsided, and I started vlogging. Now, be mindful that I went to spend the weekend at Sarah's because my husband was on a ministerial trip. And the same day this happened was the day that he was meant to minister. So I couldn't even tell Sarah, like, okay, call, okay, because, imagine having to hear that, your pregnant wife is currently at the hospital because she's having so much pain. We don't know what is the reason and all of that. And then you have to go on the altar to minister. So I was like, you know what, let's not tell him anything. Also because we wanted to know what exactly is the problem, so we know if we have to actually panic or not. So we didn't want to give like any false alarms. So we waited till he was done. And then we sent him a message and all that, and he was already coming back, like flying back the next day. So he literally just landed, and then the next thing he was on the next available train to come meet me at the hospital. So he came straight to the hospital. Now, in all of this, I am throwing up. Like I think I can't remember how many times. That was I threw up to the extent that I was supposed to go in for a scan, and just right before the scan, I was about to throw up on the floor. And if you see the speed of the light with which Sarah took a dustbin bin and gave it to me, just so that I could not like throw up on the floor, was amazing. But yeah, she was with me. Her family was with me. They were saying different things. First, they were checking for my appendix, and they could not find my appendix. Even up to when I went into surgery, they had not found my appendix, so they could not even see if I actually had appendicitis or not, because obviously I was pregnant. And so they thought I had an ovary torsion, and they had to call a consultant because they were not sure. Even though they suggested that I had an ovary torsion, they still weren't sure. Now, I wasn't even thinking about the fact of what exactly is going on, but the fact that they were talking about appendicitis, talking about ovary torsion, and in my head I'm just like, I do not know much about medicine, but I do definitely know that all of these cases, the only remedy is to have an operation or a surgery, right? And I'm pregnant, so how is that supposed to work without, you know, affecting baby? So that's the only thing that was in my head. But I was like running between I've forgotten what's called, but basically the x-ray department and gynecologist. Ovary torsion, gynecologist was like, absolutely not, y'all don't dare touch this woman's ovaries. My ovaries are perfectly okay, and that's not ovary torsion. And then I'll go, and then they'll send me back down to scan again, and then go up. It was an up and down thing. But it got to a point where they were like, you know what, they're just gonna discharge me, like give me maybe some painkillers or something, discharge me so that I can go home and kind of monitor it and see how I feel. Guys, that was, I think as soon as they just said you're gonna be discharged, that's when the pain said, you know what, it's like I've been keeping calm too much, and then it escalated so bad. The chair I was sitting in and speaking to the doctors in front, I fell off the chair. I was rolling on the floor. My husband was just like, you guys have to like do something to my life, like you guys have to do something. From I'm discharging you, like he was literally like writing my discharge papers and everything. He literally cleared everything and was like, you are scheduled for emergency surgery and you're going into surgery room in the next 1 hour. So they were like, somebody was scheduled for a CS, so they would literally like do a CS for the woman and then come pick me up. I think for some reason they didn't do the CS to the woman, so I was picked up even much earlier than my time, and which you guys will see soon, that I went into the surgery room and I didn't say a word. I think you guys will see it from my face. I didn't say a word when I was being rolled in. I was so scared because we had to ask like, what will happen to baby? Is baby gonna be all right? And they were like it's not literally like a major surgery, but of course things can go wrong because they have to be truthful with me, but at the same time they don't believe that something should go wrong, since I'm still like in my second trimester and I didn't even have a very big bump. So, you know, in my head I was the pain because of the pain I had. I literally looked at my husband and told my husband that, you know what, I love baby so much, I'm expecting this child as much as you do, but in this moment I have to put myself first, because I mean, if there's no mom, there's no child, right? So then I was rolled in for surgery. The surgery was going to take, they said it was going to take about 45 minutes, but from what I was told, my friend and my husband, I think I went over 1 hour. So I think they also started getting a bit worried or stuff like that. But by the grace of God, I came out of that surgery whole, hearty, and with my child. And I was so happy. Of course, the pain, guys. The pain, every day I still see my the places that the cuts and my stitches, not stitches, but like, you know, basically the scars. Yeah, so I still see my scars every day, and I just thank God for how far God has brought me. Like, I never thought I was gonna, not I never thought, but I was really scared when I went into that surgery room, because all of my head was like, will I carry this child up to this time and then just lose it because the devil want to, you know, rob me of my joy? But yeah, that's just a little story about my laparoscopy. So enjoy the rest of the vlog. Bye.
She's awake. Oh my love.
You did great.
Berlin.
After crying.
Come. You're sick and you're asking for photos. This why you can displace priorities. I'm supposed to go the other way. This way. Come. So how do you feel today? Day 20 minutes to day 4.
This is the longest I've ever been. Longest I've been in a hospital. And I thought that the longest I've ever been in a hospital would be for pregnancy. But I feel better.
And you look good as well. So,
That's what my husband says.
doesn't she look good? Not like someone that
I have
just...
pimples.
Anyways.
But yeah, Shasti is forcing me to take a walk. Can you see? This is where we are.
How many weeks?
This is my second trimester. How does it feel like you're entering my face?
Yeah, I'm actually entering this.
This is second trimester.
How many weeks?
15 weeks. This 15 weeks, and I don't want to say this. I am.
You're really excited.
What I want to say is health. It's today I know when you say health is wealth, health is wealth. It's until you feel it before you know the meaning of health is wealth. I don't even know if you guys can hear me, but health is really wealth. I'm okay. I'm at least like.
Yeah, wait now. As you're moving.
It can't be compared to the pain I had previously, but it just hurts in stitches. And maybe me and Shati will do sit down video to speak about our different perspectives.
Alright, see you guys. Bye.
Soon. Guys, I'm having my first dentist appointment. I'm looking. I have a lot of things to say, but this is the first time I'm picking up my camera after surgery or after leaving the hospital. I'm currently at the dentist. I'm gonna have my appointment because I'm tired and I'm feeling a form currently. Guys, first of all, can you guys see how slim I am? I look very unkempt just because I've always said that I'm going to humble pregnancy. I mean, pregnancy has not humbled me, right? What do you guys think? But I've gone through a lot, guys. From me discovering that I have hyperemesis gravidarum, I have gone from weighing 83 kg to weighing 79. And that was the last time I checked. I currently don't even know if I've gone lesser. And then I just checked my teeth. Looks good from here, but pregnancy brought parodontitis. Paradontitis, I think in English. And I have worked with like on this dental. I worked in a dental industry before, and I used to just hear people having it, and I was just like, I have to read about it, and I'm like, now me having it, I'm like, how? And the one was just like, comes with pregnancy. So I've gotten like a pamphlet to read about that alongside with like how it comes with pregnancy and for some people. Guys, when I say my gum bleeds, like it does, like I just have to just basically do like this with my brush and I start bleeding. And I don't used to be like that before, but this is where I am. And I have to go through an intense cleaning, and then there are some treatments I have to go through. I really don't know what to say. So the time I'm filming this is the beginning of my second trimester, by the way. So even according to my app and my gynecologist, this was the best time to come check my teeth up. And the woman just said, thank God you came as soon as you could. That I came at the right time. But yeah, I've not been eating. I eat like once a day, and that is even if I'm able to retain that. My sister-in-law is coming to stay with me for the next couple of days, for almost a week basically. She wants to spoil me with food, and I'm very grateful to her. But I just pray I'm going to be able to retain this food. My skin is looking very bad. I'm thinking of doing some mask. I'm gonna take off my hair as well, and I'm just gonna go to wig, I think. And summer is kind of coming. Like, my skin is very, like, I don't know how to put it. My skin is becoming like very, I don't know if say it's not giving dry skin, because I'll start having oil soon, but it's giving like it keeps breaking. Like, not breaking in like, oh you're getting pimples, no, breaking like when you break something, when you are like shredding something. Guys, pregnancy, even if I'm not like looking very bad and everything, it has definitely showed me its different sides. By the way, because I don't retain anything, I don't have a bump, I don't have absolutely nothing. Like, my stomach has been the exact same stomach for the past 4 months, to the extent that even when we were having surgery, by the way, my surgery, my stomach is still hurting a bit. I can't wear trousers that have to lock like down there. So right now I'm wearing a very, very high-waisted, like you see, a very high-waisted pants. That's the only thing I'm able to wear. At least now sneezing and some other things don't hurt as much, but I still feel it there. If I like bend and kind of bend my navel, oof, that I can feel. And then after showering, sometimes I also feel a bit weird. I have my first appointment at the gynecologist since the surgery tomorrow, and that's to check my stitches. Basically just check. I have a lot of things to check. I feel like tomorrow is going to be a long meeting because I have a lot to say. This hyperemesis thingy is driving me crazy. If you guys know the medicine I take and I still throw up. See, if you see a pregnant woman in the street, double left for that woman because cozy. Some people have it good, yeah, but for some people it's really bad. I've been wanting to vlog my sister-in-law for all of you guys for the past 2 days, but I always forget. My sister-in-law came to help me, or at least to show. She was supposed to come and show me love for almost around about a week, right? Now tell me why my sister-in-law has decided to be the pain, the torment, the torture. Every morning she shakes me. She they be like turbulence. This is what I go through, Sha. This is how, after they will say me I'm not affectionate. It's alright.
No, you're not.
But this is the love that me and Sha receiving. No, this is the love. This not even be safe, because if it was for me, I would never see this woman in my house. If not because of baby, this woman should not be here.
Then all of them go say I don't take care. You can see now.
That's all. But yeah, guys, this is 15 weeks pregnant. 15 weeks pregnant, and I'm tired. I don't know how many times I've said I'm tired in the last first trimester. God. I think the reason why people say I'm tired is because I do not see a bomb, and it's like, where is the pregnancy? At least be showing forth, so that when I'm complaining, I know what I'm complaining about. But yeah, guys,
Kind of high, but he doesn't want evil people to see him or her.
I do not have a bomb, guys. I do not have. Yesterday I was watching a reel of this girl in Nigeria. I think she's a bit famous. I don't know. I've forgotten her handle. And she was doing this transition now, like for every month. And it was so funny that her own 4 months, basically her own 1 month is my own 4 months. And it was so hilarious because her 4 months, the belly was just shooting like this. I'm like, I cannot relate though, because me, I can still at least fit in my old clothes. But she was like, her stomach was so big, her 4 months. And I'm like, I cannot relate, Sha. Oh yeah, that's just a tiny bit of updates. Guys, I'm just thinking about the day that I'll actually sit down and have to edit all these vlogs for all of you guys. Poof. This is where Sha. Wait, but yeah. Choose, guys. And if you watch this, help me type I love you yourself, because I actually do love her. She's been a very huge source of help and joy. So bye. Mwah.